A recent report concludes that 742 rural hospitals are at risk of closing, with more than 300 of them classified as being at immediate risk, and proposed Medicaid cuts could push them over the edge. Local papers report that for rural areas in the South and Midwest, on the East and West coasts, Medicaid cuts pose an existential threat, bringing bipartisan warnings.
Tens of millions of Americans will have their health insurance rise dramatically because of the cuts.
If we lose $3 billion for hospitals, I can't say we're going to be able to keep all of my hospitals open.
I'm worried about that. And we've seen a lot of them close in my state. I'll be honest with you. We are already, as it is, we are struggling with rural health care coverage.
And Colorado Public Radio reports that an entire cluster of rural counties there with about 50,000 people could face a total shutdown of health care if Medicaid is slashed. That's where we find our next guest, Connie Martin, CEO of San Luis Valley Health. Thank you so much for being with us, Connie. And I know you provide health care to 6 rural Colorado counties. What would the proposed cuts mean for you and for your patients?
There's just no question that it would negatively affect healthcare in our region. We serve about 50,000 patients in rural Colorado, and almost 40% of those have Medicaid. And with the loss of that, there would be no revenue to help take care of those patients. And you know, when they lose coverage, they don't lose the need for health care. And so those patients would wait till later in their disease process, wait till later in their illness. They would show up at our emergency room. It would be a crisis on our healthcare system. And we just, as a rural hospital, would not have the resources to take care of them. So it would be devastating to our rural healthcare system and likely to many, many of our peers as well.
Medicare and Medicaid Service Administrator Dr. Mehmet Oz says that any deserving, that's his word, deserving Medicaid recipients will be shielded under this plan. As someone who would be impacted, your 50,000 people would be impacted. Have you gotten any indication of what the criteria is to be, as he put it, deserving of coverage? Can you even define that?
No, I can't. You know, the details in the bill so far have been hard to understand, and I think it's really early in that process. I will tell you that in Colorado, just in the past year or so after the pandemic, there have been 575,000 people that have lost their Medicaid coverage, and that's in what we've defined as what we call in Colorado the unwind. And with that, we've seen over a 40% rise in emergency department coverage. And I know in our valley, in our region in southern Colorado, many deserving and qualified patients lost their Medicaid coverage through administrative issues and through problems with the Medicaid eligibility system. And so there are a lot of challenges with Medicaid that have nothing to do with the eligibility of the patient. The process to qualify for Medicaid is extremely complicated. And so I don't know what that word deserving means, but I think that the system is very, very critical and important for patients. And for rural hospitals, it's essential for their survival.
Let me ask you, we only have a minute left, though, about the broader picture. The healthcare system is the biggest employer in San Luis. That is not unique. In 2023, U.S. hospitals directly employed 6.6 million people and supported nearly 1 in 6 jobs across the country. They purchased more than $1.3 trillion directly in goods and services. So beyond healthcare, what would the loss of hospitals mean to your area?
There's just no question it would have a devastating impact on our entire region's economy. We're the only hospital in our region that delivers babies, that provides surgery. It's 120 miles to the next facility that provides comparable care. It would devastate our entire region's economy, not only because of the 700 jobs that we have, but because families couldn't live there. You couldn't count on having services. We have a national park in our region. We get nearly 700,000 visitors a year. Think of the number of tourists and visitors who count on our healthcare system being there when they just visit. You know, not only do Medicaid patients lose when a rural hospital closes, but the entire community loses, the entire region loses. So, you know, when we count on Medicaid for a third of our revenue, but when a third of our revenue goes away, healthcare could go away for all 50,000 residents. And that's true of every rural community in the country. And there are many, many rural hospitals that are even much more vulnerable than mine, and they could be impacted much quicker. And the trajectory to close rural hospitals could be very quick in a major Medicaid revenue decline.
That is a sobering and incredibly important message. Connie Martin, thank you.